All right, good afternoon. Let's please reconvene from our break. And we will move on to the final item on our afternoon agenda today. And I'm feeling very grateful that we have this item and the presenter that we have today, and that we are starting this really important conversation as a county. So we are on to item 11B, which is a presentation and discussion called Moving Towards Equity, Understanding the Impact of Racism in Communities. And to lead us through this presentation and discussion today, we have Dr. Jei Africa, who is the Behavioral Health Director for Marin County, and was introduced to Mono County through our behavioral health department. And as the board may recall, and for our staff and members of the public listening, this agenda item and the work we're about to engage in really started as a discussion back in June with Sheriff Braun, who's here, and I'll let her say a few words here as well, to start talking about how we address racism and disparity in law enforcement. And this board, the Board of Supervisors and our staff and the sheriff all agreed that it really was something that we need to address in a bigger conversation. And of course, the sheriff's office is also addressing it, and Sheriff Braun led us through some of the ways they were working within their department. But what we're doing today is really a county-wide, community-wide effort, and I'm looking forward to it. So before we get into the presentation, I would just I want to thank a few people who have been working to make this presentation and this discussion possible. We have Cassandra Montez in behavioral health, Jasmine Barkley in probation, Amanda Greenberg, who she's on our panel. If she wants to be, she can raise her hand, enjoy it, from behavioral health. And then behavioral health director, Robin Roberts, and of course, Sheriff Braun. So I would invite any of you at this point to say anything. Sheriff, do you want to?
Sure, I'll kick it off. First, thank you, Supervisor Corliss, for moving this forward and keeping us forward thinking on this, and to Jei Africa for joining us today and helping us along in this process, and to Robin and Cassandra and Jasmine and everybody who's been working on this. It's a collaborative effort and something that we need to just keep talking about and keep in the forefront of our minds, and always strive to be your better self. So thank you for that. The Sheriff's Office, we continue to work on it. And of course, we're mandated to, but we choose to do that as well. And Mono County is a diverse county in a different way than many other counties. So we have our own issues that we need to work through and communities that we need to reach out to. So thank you all for being here. And I'm going to hand it off to Robin, because I bet Robin's got something insightful to say.
I apologize, my dogs may bark, of course, because my assistants. I mostly just thank you everyone for being here, for showing up for this really important conversation, and for the continued work it will take for us here in Mono County to deal with some of our equity issues and take that on with some language that we understand through Dr. Africa. And I want to thank Cassandra for all of her help with this, Jasmine as well. And I think we're ready to go. Take it away, Jay.
Oh, Supervisor Stump, go ahead.
I just want to note, since Dr. Africa is new to my screen may go black because I get an unstable internet message. So I kill the video to protect my broadband. I will still be listening. I'm not disengaging.
Thank you. That's an important note. And also just, we'll have a presentation and then we'll move to discussion. And for board members, the presentation was sent out, and it will also be posted on today's meeting page on the county website. So with that, Dr. Africa, please go ahead. And
sure. First of all, I'd like to thank you for the invitation to join you. Thank you, Chair Corliss, and Robin too. We are really at an interesting nexus in time, and I think these kinds of conversations are necessary. And so I am really grateful for the opportunity to sort of be with you. So let me try to share my screen. Always is an issue with screens. All right, so, right. Can you see the screen? Is that okay? Can you see it?
Yes, that's great. Thank you.
All right, here we go. And it's sort of weird when you see yourself kind of talking, so I'm gonna try to do that. So I wanted to just sort of, again, the title of my presentation is really Moving Towards Equity, Understanding the Impact of Racism in Our Communities. So first I want to just acknowledge that we are really on ancestral land of the Payotes, and that all of us are actually in the United States are on indigenous land. I also want to acknowledge that I am a guest in your community, and so I'm going to share some of my sort of thinking as a guest, not knowing that I live there, not knowing really sort of the issues that you sort of face as a community in a level that obviously the folks who live there know much more better. So my ask as I'm having sort of this presentation is really to be open, to have an expansive mind and heart, for folks who sort of are listening to pay attention to your feelings, your questions, and what's coming up for you, especially as we go into really hard conversations and hard facts, historical facts that I'll share with you. And my hope is to really inspire you, more importantly, to move and compel you to do something different, and to move you and compel you to action. Because conversations can only go so much, can only be meaningful if you do something differently that will change the situation or change the narrative of your residents. So I want to do a sort of a context of where we're at right now. As you know, the world is dealing with COVID. As of this morning at 7:40, we have about 191,000 deaths in the United States and about 6.5 sort of million cases. You know, and it basically just tells you that it's going to keep increasing until we find sort of the antidote, and also that people really understand what we need to do to prevent this virus. But in addition to that, we are actually seeing the inequities that COVID is exacerbating. Many of the inequities that we're seeing have existed even before. And so we're going to talk a little bit more about that. One of the things that we're dealing as a country is really all these protests. This is the one that really just recently happened, I think about a month and a half ago in San Francisco. People are talking about no justice and no peace, which is really brought about, I would say, more elevated by the death of George Floyd. But we know that these issues of racial injustice sort of have happened for many, many years and many centuries. But at this particular time, his death really kind of sparked a much elevated conversation about race relations in this country. But we also think about that you know, these protests that sort of are happening also talk about the sort of the relationship of the community with law enforcement. And, you know, I happened to actually watch the presentation in June and July when Sheriff Ron did her presentation, and the discussion that was brought about, and really listen to your board meeting, and that you really are sort of in tackling about sort of these really important issues. But the commitment, for example, that Chief Braun said, that, you know, we don't have military equipment, right? That we are interested in an advisory board to really improve your relations with the community. But I think as a nation, we have sort of this interesting relationship with law enforcement that we'll talk about in a little bit. The other thing that this country has struggled with for a long time is how we treat our immigrants, how we see our immigrants. You know, we are pretty much a country of immigrants. And I think we just have had sort of this weird relationship on how we see them, how we treat them, that we consider ourselves really as immigrants. And so these are all the things that sort of are happening in our nation today. And then if that doesn't sort of give you sort of a pause to say, like, can I take one more? We are sort of dealing with the climate change, you know, and this is sort of a picture of sort of what's happening in Northern California, that many of us are really being affected, have been affected actually for a while. And I think these are sort of the things that we are dealing with in our current context that really are asking us, what do we need to do differently? Because these things are sort of happening in our community. So that's the context. And I want to just, take a moment that's a lot. And if you're thinking about like, what are sort of the feelings that have come up because of these things, let's start going through a little bit more history to dig deeper. Why are all these coming up right now? So when we look at COVID-19, we noticed, I would say, unfortunately, later on, in the beginning of COVID, we did not look at data that looked specifically on categorizing by race and ethnicity. At least for, in the Bay Area, this just sort of shows you actually the disparities that COVID has really elevated. And this is actually pretty much across the country, that most cases of COVID are seen in our Latino population, again, especially in the Bay Area and many parts of the country. But the death rates due to COVID are seen much more significantly with our African-American population. And you're sort of just thinking about that, and like, what are the implications of that? So I know that in Mono, you're lucky that there's sort of very been little with sort of COVID. I think I saw the data too. But again, Mono is special in some way, but the country is sort of dealing with the effects of COVID just systemically. And this is what the data is saying of who's being more affected by COVID. When we talk about COVID, we also talk about not just the physical toll, but really the emotional toll. And here is a data that came out from the Pew Research Center when they ask people of color who are more likely to be affected because of their race by coronavirus, by COVID-19, right? So they did the poll and asked people, how are people being affected? So this basically tells you, they asked the question, have people acted uncomfortably because of your race, your race during COVID? Have you been subjected to slurs and jokes because of COVID? Have you feared that someone will threaten you or physically attack you during COVID, whether it's because, right? So you can see here in this graph that our sort of white population pretty much have experienced some of that, but most of these negative experiences have been experienced by our Latino population, Hispanic population, our Black population, and our Asian population. So again, you're thinking like, well, why is that the case? Well, we'll talk about that later. But again, if you're not asking the questions, like what's specific about these experiences that people are experiencing or seeing or experiencing these negative incidents towards them? Specifically in the beginning of COVID, we said that, that there were people who were in the media talking about where the virus came from. So particularly in the Asian population, it was being blamed as the Wuhan virus, right? So it compelled many of the Asian community to really think about how do we say that it's really not our fault that the COVID is here. So there's this whole slew in the Bay Area, actually it's actually not the Bay Area, but a group of Asian organizations that came together that did some messaging that they're not the virus, that we really, because of the xenophobia that they were experiencing and all these negative attacks to them, that they really were saying, that COVID affects everybody and this is sort of really not our fault. And for a community to really start saying that all their negative experiences were probably because of this really negative messages was really appalling. We also talked about the mere fact of wearing a mask, right, was supposed to be preventive, could actually be a matter of life and death for people. So here is an article that came out in June when they were actually interviewing and asking folks, telling people to wear masks. And then they said that, the folks that they were interviewing said, I'd rather actually die of COVID than die of a violent death, because when I wear the mask, the stereotypes, I'm a criminal, people, I'm untrustworthy, actually escalate. So for Blacks, they're saying like, I'm going to just choose whether I want to die because of COVID, so I'm not going to wear that mask, or I'm going to die of being treated negatively and the violent acts because I have to wear a mask. And it's a similar experience to wearing a hood. Right? To wearing that hoodie that have gotten some of our African-American individuals killed, right? So I'm going to pause for a little bit and saying like, those are really decisions of life and death. With a mask, $2, maybe $1.50 a piece of equipment that supposedly save lives. Black Lives Matter, again, has to sort of, as I said earlier, this really like sparked this conversation about race. But when you really look at the, you know, again, the death of George Floyd, there were actually many people, and this is just a sample of Black or African Americans that had passed away since Eric Gardner a few years ago. This actually, we need now to add, although he didn't pass away, you know, Jacob Blake, that was sort of shot recently in Kenosha, right? All of these folks have been killed since Eric Gardner, African American, has been killed since Eric Gardner. And if that doesn't sort of make you pause a little bit of what the inequality that is happening because of your skin color, I don't know what else. So the relationship that we have with law enforcement, as I said earlier, it has been kind of an interesting one over the century. And this is a picture in the 1960s when sort of law enforcement was sort of interfering or, you know, or sort of not interfering, but sort of addressing some protests, right? And this history has not been forgotten, actually. And this history has actually an earlier history that talks about our sort of this mixed relationship, mixed feelings with policing just in general. And I'm going to talk about that in a little bit. And then the last one is this climate change that we're doing. Like we have done, in my opinion, really a disservice and really killing the earth. And this is, again, just sort of my perspective. The fires, the drought, the extreme heat are not just affecting a small group of people, but it's really affecting all of us. And if you feel like you're not that population that's really being affected, I would beg differ that actually climate change is affecting everybody. So that is sort of the context that I think is really important. And now I want to talk about how I understand these issues that we're facing. Sorry that my light is just automatically going off. So there are two people that I actually look into towards understanding is the work of John Powell. The first one is John Powell. John Powell is a scholarly activist in UC Berkeley. He oversees the Otherness and Belonging Institute. And he talks about that the biggest problem of the 21st century is that we have created this sense of otherness and belonging in our community. That we have people that belong, and that we've also created people that don't belong or create others. And that when we make people belong to whatever group, community, the sense of that allows them to create the resources and the power when you belong to a certain group, right? So when you belong, that you have the power, you have the resources, you might have the rights, but when you are seen as other and not part or belong, that you are seen as second class, that you don't have the same resources I have, or that maybe you don't have the same rights as I have. And John Powell talks about that it's not just really otherness in terms of other people, that we actually as a society have disconnected ourselves to ourselves, who we are in the core of being of who we are. That's one. That we've disconnected ourselves to other people and our disconnection with humanity. But more importantly, that we have disconnected ourselves to nature. And I'm going to share examples of what he means by that. That we really have not connected. So in that level, we've disconnected to ourselves, we've disconnected to other people, and we've othered people, and we've really disconnected to nature. And it's reflected to how we're treating Mother Nature, and the effects of that are being seen in this really significant climate change. The other person that I look to understand what's going on is the work of Dr. Rupa Maria, who is an internist at UCSF, or University of California in San Francisco. And she talks that historically medicine has been focused on many, many different things, but particularly in this century, that the focus of medicine is really addressing inflammation, cancer, right, for example, that has been a result of generations of trauma that has been carried through our genes. That some of the ones that were being carried in our gene has been products of centuries of historical trauma that have traveled now because have never been addressed. Dr. Maria also talks about that this piece of trauma has started really from the concept of colonization. And she describes colonization as being disconnected to our ancestors, to our culture, right? That many of us have been disconnected to culture, to our culture and to our ancestors. And that produces, because of that disconnection, to a concept called supremacy, meaning that I'm better than others. And that's linked to what John Powell says, because I have othered you and I see you as different. And because I see myself as better than you, that I have created policies, structures that make me more, quote unquote, powerful, right? Because I am better and more superior and you're not. So that's what Rupa Mara says. But also have supported in this country that of capitalism, that supported the concept of capitalism, which means it's just looking for our own opportunity to incur wealth, right? And that we will do everything and anything to incur wealth. And if you already haven't noticed, that one of the foundations of this country is to bring in slaves from Africa and be able to and have them to do cheap labor. That we have, for example, even treated them not as human beings for the benefit of incurring wealth. So those are the two concepts that I am hoping helps set you or gives you the context of how I see this work. Othering and belonging, and then trauma, decolonization, and supremacy. So I'm going to pause for a minute. Those are really big terms. So as I'm now from a very 3,000 foot level conversation, I'm going to start bringing down a little bit. So we talk about race a lot, and we have now known at this piece in time that race is actually not a biological concept. There is much more difference between intra-races, between races than compared to different races. The Human Genome Project has now shared that we are actually much more similar to folks that are not part of our race than folks that are sort of within our race. And that race was actually created as a social contract to create categories, right? Other and belonging, and also to separate who will get the resources and who will not. So I define racism, or one of the things that I sort of helped me understand racism is that racism refers to a social system that reinforces that a racial group is more superior than the other. Some is more superior than the other. And because of that superiority, the other, the one that's other, is treated unfairly. And the one that's considered superior has some advantages over the other ones, right? So it's a social system that reinforces that one social group is better than the other, that there's an inferior and superior. And that all of us has the capacity to be racist because we grew up, in a socially racialized society. I'm going to say that again. All of us has the capacity to be racist because we are born in a society that socializes us to really be racist. None of us are born as racist. We learn that through the media. We learn that through our community. We learn that through our school. We learn that through history books. We learn that through our parents. So I know that's a powerful statement, but the reason why I'm wanting to say that is because it is learned, it can be unlearned, right? Even the most anti-racist person can be racist in certain times of their life. But that opportunity, though, allows them to self-reflect and say, what can I do to enhance my understanding so that I can act in an anti-racist perspective? So it's really important because when we talk about racism, many people tell me, oh, I'm not racist. And I think people oftentimes think about that as always just a personal thing. Like, I never owned a slave. I didn't treat somebody disrespectfully. I was never overtly racist. But the tendency that because this is learned, that many of us have ingrained that in our lives. And even the work of people like me who tries to move forward equity can be racist because I have learned to be like that. But, and the one thing that I want to say, and I shared it in my presentation at the CBHA, is we talk about race quite a bit, all the time in our information forms, in our census, in our assessments. But actually, we as a country have had difficulty talking about racism. It's easy to talk about race, but it's so hard to talk about racism per se. And as a matter of fact, and I just want to share you briefly, that there are many studies now that are looking at historical documents of how often have we used the word systemic racism or structural racism in any of our publications. So Lancet, which is a very, very prominent scientific journal, said we actually don't use systemic racism a lot. We don't use structural racism. We refer to race quite a bit, but not the negative effect of racism in our country. Health Affairs, again, another prominent journal, did some research in their 39-year history in their journal and only found 114 pieces that literally reference structural racism or use the word racism. APHA or PubMed looked at articles again, and between I think 2002 and 2015, saw that only 25 articles used institutionalized racism. So we really have, as a country, have difficulty talking about racism. Race is easy, right? But really the deleterious effects of racism, we tend to shy away. The other piece of that, it also talks to me or tells me that we have really struggled to try to understand systems, right? Policies, practices that have been historically created that continue to have negative effects for people. And I'm going to talk about that in a little bit, right? So it's easy to talk about somebody being racist, for example, but it's much harder to talk about what can we do as organizations, institutions, to really change systems, because the work is not just with individuals, it's really changing systems. So again, I know that this presentation is really to begin your conversation, your work, is that you should be, as part of your work, tackling what are the policies and the practices, the institutions that we've still internalized and continue to promote racism and structural racism in many of our organizations. So I want to talk a little, as now I'm going from 3,000 to 1,000, I'm going to go deeper. I want to talk about the levels of racism. How do we look at racism? Like, how do we know how do we see racism? And the work really is seen in 4 areas. One, internalized, right? The upper left-hand corner. When we talked about internalized racism, it's our own individual racist ideas, beliefs that we know and believe and have grown up to, right? So what's my own growing up thinking about African Americans or Native Americans or indigenous people, how I see older people, how I see LGBTQ, that's my own work, right? So that's the more the internalized one. Well, implicit bias comes out a lot there when we talk about how does implicit bias show up. And then the next level, is our relationship with people, is the interpersonal racism. So racism when we are working or talking with somebody else, right? So when we see, for example, somebody, we're walking in a dark alley and we see somebody who has darker skin and we clutch our bags a little bit tighter, right? When we are crossing the street because we're afraid that this person looks, a certain way, right? When some of our colleagues, when they're walking to a store, they're being followed because the notion that they're criminals. So those are that's interpersonal racism. It's how we react to individuals. Like, it's the bigotry between individuals, right? That's seen. The next level, higher level, is within institutions. It is an unfortunate fact in history that we have institutions, government, that have perpetuated this structural racism, right? We have, for example, the California Department of Public Health, corrections, not public health, that sterilized people who had criminal justice when they were in custody in the 60s, I think, and also in the 70s, because they, forced sterilized people when they were going through maybe a procedure that didn't need sterilization without people knowing them, criminals without knowing them, because there was the notion that if we allowed people to, get pregnant or have families, then it would allow them to generate more criminals, right? So that's sort of institutional racism that we perpetuated, right? And then the other piece of that, the higher level, is structural racism. So it's not just within institutions, but between institutions, thinking about behavioral health, thinking about law enforcement, thinking about criminal justice systems, thinking about libraries, thinking about banks, right? Thinking about education, like how are these structures or institutions working together, whether intentionally or not, in perpetuating this racism. So 4 levels, from internalized our own thing, our relationship with people, within our organizations and institutions, and between these structures. And oftentimes when I do these conversations, people focus again on the internalized pieces, like, well, I'm not racist, but I have to tell you that our work needs to be in all of those levels. Specifically, with permission from your board, right? That you also need to tackle, because you have the decision-making capability to change policies and practices, that you tackle this work, not just on an individual or internalized basis, but also in institutions, because you oversee funding, but also within your purview in overseeing county services. So 4 levels. So I could spend the whole day talking about with you about the different levels, but I want to focus on structural racism, because I'm thinking this is where I think your role in the board and to really engage the community and the structures that really have continued to have negative effects on our community. So I say here that really in many people's eyes, and many journals, many folks, many experts are saying that structural racism has been the root cause of many health disparities and inequities. And I would just say, just not in health, but just in general. So what are the inequities that we've seen that has come up during COVID? We see, for example, and I said this already, that in many states, even if the Latino or African American or indigenous people are the small percentage of the population, they tend to have the highest rates of cases, and they also have the highest rates of deaths due to COVID, right? So I'm not going to sort of read all of these, but this just data tells you that even if they're, again, a small portion of the percentage of the population, they have the highest rates in cases. And then again, it makes you, my hope is that it makes you think like, well, what's happening there? Like, what are some of these issues that, again, that they're smaller amount of the population, but highest level of cases. But again, and Robin and I sort of know this, that these issues are actually not new to us. The inequities that COVID has elevated are not new to us, actually. Many of us know that Black and brown people in the US really have poorer health outcomes compared to white people. And the data is sharing is because it's really about how social institutions have treated them historically and currently, even unintentionally and even intentionally. And that another example is that, for example, Black and brown people or communities of color in this country are less likely to have wealth and resources here. And here's just one specific data that, how many, 11 or almost 12% of Blacks in the US have sort of form of health insurance, right? And we know in this country that health insurance can actually is associated to sort of the kind of care or some level of kind of care, especially in COVID, right? To be able to get to your doctor quickly and get the test and get the medications, for example. And in the mental health field, where my focus of my work is, despite the need, the high need, many of our communities of color don't get the services that they deserve or need or get or ask. So 1 in 3 Blacks only get the care, and really also compared to our white counterparts, only 33% of our Latino population get the mental health care that they need compared to our white colleagues, right? So again, really showing you the disparity. And so thinking about this again, I'm going to globally step back a little bit. Structural racism really plays a role in how we're seeing. We know in many of the populations of color, COVID is, the rates, diabetes is high, hypertension is high, asthma is high. But here are sort of I really tried very hard to piece out, in my opinion, what are some of the issues that could be explained by the structures that put these inequities front and table. One, Black and Hispanics live in communities where they are exposed to a higher level of pollution, talking about asthma. People are less of color are less likely to work from home, right? COVID, we know that many of our essential services or folks that are more exposed have jobs that are low paying and don't allow them to work from home in the retail industry and food service industry, for example. We see the inequities in housing, employment, and education, food security, right? We see, for example, again, our Latino or Hispanic population are less likely to be uninsured. And you just look at all the medical issues that you can see that could be maybe explained by that. And then here's the one thing that we're really constantly struggling is the implicit bias in medical institutions. And I'll just say to you that the bias is just not in medical institutions, and it's pretty much everywhere, right? So imagine if you're somebody that, it took a long time for you to go to seek help, and you're finally going to see a doctor or go to wherever to seek service. And then you have a provider that's not culturally humble or culturally competent, right? And your experience as a person of color, and they're really not understanding and not giving you the care that is aligned with your culture. You might say, I'm never going to go back there because I was treated really poorly and they didn't understand me. I was humiliated. And then that decreases the likelihood that they will get the care when it's necessary or come back because of that negative experience. So I want to pause there because that's a lot. And Chair Corliss, I'm hoping that this is what you're hoping for. And I want to just pause that's really a lot, but if you feel a little bit uneasy, I'm going to give you a warning that you're going to be a little bit more uneasy right now as I move to the next part. And again, as a guest in your community, it's easy to do that because I can just, after the Zoom, you probably will not see me again. But really to really bring you some of the really difficult issues that I think your county really needs to tackle. So now when I go a little bit deeper to history about the structural racism that has persisted, I'm going to go really now to the hard conversation, right? We know that in this country, that many of us really are visitors or immigrants, that unless you identify as an indigenous person or Native American in this land, that your land or their land has really been taken away from them. And this is just an example that when the white settlers were really giving away and selling the indigenous land to people for their own benefit, right? This is a painful part of our history that has still ramifications today. And I think that's just something that we really need to grapple with and really address. That's really hard. And it's important for me to sort of recognize that as we're really having, really providing that context. When we talk about othering, right? We talk about somebody's better than others. Here is a picture where we actually had a lot of indigenous people that we tried to Christianize because they were savages, and we helped them to become cultured. A picture of some indigenous people where we shift them up to force them to go to boarding schools. This one is particularly in Pennsylvania, when they were really forced to wipe out their culture and change who they are. And hundreds and if not millions of people really eliminating their culture, right? With the notion that if we as the settlers can change them and help them be better. And that again is a painful part of history that we've seen that has major trauma effects still that many of our people, many of our colleagues and communities are still facing. And and I use this slide quite a bit because it really brings up a lot of painful experiences. Having also not grown in this country, I grew up in the Philippines and experienced some of the colonization of being under Spain, the country that I have grown up, being under Spain for 400 years. And that we were forced to really kind of, I would say, forego our culture. And many of us are still feeling the effects of that generations and centuries after. The other thing about othering is talking about, in this country with Jim Crow, right? If you remember that there was the Jim Crow law that really said, whites can sit in the front of the bus and blacks can sit at the back. And if you're Black, you're considered property, you can't vote. The history of slavery too, that you can be sold, right? And really talking about who has more power and who is delegated, doesn't have any power. That continues, again, the social and emotional toll of being considered as other. And I think that's really just important. That still continues to this day, which really, many of what the Black Lives Matter and this racial injustice is coming to really ask us to really do some soul searching. The history of policing actually runs deep. If you remember, and people are asking like, why do we have such this really negative experiences with law enforcement, with policing? It's because historically, the history of policing in this country started with the development of night watchers and the slave patrol, right? That white people were empowered to patrol the lands, to find slaves that were running away and bring them back or punish them to their owners. And that really is the history of policing in this country. And so if you feel like, well, why is all these negative notions about law enforcement and policing? It's because of that history that has been through many, many centuries that people remember, maybe not intellectually, but in their bodies and in generations, right? Even people, regular white people, when I say regular, they're not necessarily could have been deputized at that point, were be given a responsibility that you can punish slaves that were running away and bring them back to their owners. I mean, you didn't have to be deputized, yet you could just be a white person doing that. And that's why you have this sort of relationship with policing in this country that has really generations, if not centuries of history. We also talk about redlining, and I don't know how familiar you are with this concept, but this housing issue that many of us are looking at, not just in the Bay Area, but I actually looked at some of your data that that affordable housing is an issue in Mono too. That had the history of like this issue of affordable housing started years and years, decades ago, when the government and certain structures literally looked at the map of the US or parts of the US, and this is an actual map of Los Angeles, when the homeowner loan corporation or HOLC or banks would literally look at the map and circle or color communities where they will say, if you live in this specific community, either green or yellow, we will give you a loan so you can buy it. You can buy your house. Literally, redlining means lining maps and say, if you live here, you can get loans. And if you live in areas that are colored red, we consider that as places that we are not wanting to make any investments. And what we've seen over time, and these data is available, is the communities where we redlined as red were mostly communities of color, right? The communities that were living there were communities of color. If you look at that left side, the green one over there to the top left, it says Beverly Hills is green. Well, in LA, Beverly Hills, one of the most expensive places to live and one of the most, I probably would say, healthy places to live. Decades and decades of policy continues to sort of still exist that continue to benefit people. So redlining was a policy that we have created that have now we historically created and continue to affect us to this current day. And there are many maps like this that's sort of available for you to see what areas have been redlined. And as you will also see that these areas that have been redlined are being negatively affected, not just by the economy, right? Wealth, your home wealth, or how much your housing costs, but your health outcomes too. So if you are living in those areas, that your life expectancy might be lower or shorter than the folks living in green or blue areas. So I want to talk about climate change because I'm front and center in this work. I talk about air pollution. And you know, one of the things that I have been fortunate enough as I'm really deep diving in this work is learning more about environmental health and environmental justice. I didn't know that air pollution actually kills about 100,000 people a year. And then, but air pollution or deaths from air pollution are actually felt unequally in this country. And here's where I want you to pay attention to, and I'm going to do my best to explain it. Everybody, all of us, creates pollution. Every one of us. So that's called, that's the pollution that we create, all of us. And then we also are affected by the pollution that either I create or everybody else creates, right? So we create pollution and we are affected by pollution. Studies now are saying that whites are affected by less pollution. I'm going to say that again. Whites are affected by less pollution, even if they create more pollution. Whites are affected by the pollution, even if they create more pollution in this country. Compared to communities of color that produce lesser pollution, but are affected and exposed at a higher rate than the pollution that is created in this country. So as a person of color, I might be only part of community of color, I might be creating less pollution, but the impact to me in my community is much higher. So that is called the pollution burden. So people of color, communities of color, have a higher pollution burden or burden of pollution that we carry, even if we don't produce that much pollution. So, and thinking about, well, why is that? Why is that? Well, let me get back. And this is why, right? Because certain areas where we live in are much more exposed to pollution. Because historically, the banks did not invest in areas that could really help us maybe have more nature, or maybe was not a site for dumps or a dump site or petroleum chemicals, right? So these are really complex relationships that have really affected our health outcomes. I want to also talk about, I want to dig a little bit deeper. And again, I'm sorry for spending a little bit more time on this because I really am very affected now by climate change. When we talk about, well, how do we know and what are the drivers that affect us disproportionately? Like, why do people get more affected than others? There's three things. One is our proximity to the sites, the sources, right? Are we in places where there is manufacturing companies or pollutants, right? So there are, Richmond, California has a lot of industrial building that produces that, for example. Are we exposed to natural disasters, right? The wildfires right now, what areas that, are more exposed than others, the heat waves, pandemics, and then the social environment, right? So I'm gonna talk a little bit about that, the health disparities that affect, all of the situation, our climate. And I think about, who's more exposed right now. And I'm thinking about, for example, our agricultural workers that are picking up, the strawberries and our grocery and our vegetables that is exposed to the smoke, right? That even when we have fires that's raging in California, that we have folks that are on the field, or agricultural workers, mostly Latino, that are still picking up those strawberries or our celery or wherever else, that probably are wearing the bandana and exposed to specific heat, really high temperature, and also being exposed to smoke, right? So again, disproportionately, who are the folks that are being really affected by these issues? And then we talk about what other communities are being impacted. And if you have not paid attention to Flint, Michigan, that community for a while was saying, hey, our water is being exposed to lead, right? And there's actually, all this talk, and people in the community was raising, hey, we're not going to drink this water. And yet the officials were saying, no, it's fine. Actually, it's just the color, but it's actually safe. And they realized, actually not. And for a long time, they were telling the community, nope, it's safe. And you again imagine, right? Local government saying the water is safe, but actually it wasn't. and comparing just in that picture, like what the water from Flint, Michigan looked like, and then the Detroit water, people are saying, are you serious? And you don't see the difference? And that they are actually, the pipes were full of lead that has negative impacts with our health outcomes. And who are living in Flint, Michigan, or the communities that were affected? African American, right? Again, communities of color are deeply impacted. And then again, if you have not paid attention to the Dakota Access Pipeline, when there was the plan to really build an underwater oil pipeline through a few different states up to the north, and some of our indigenous people were saying like, not, and Standing Rock, or Standing Rock, I would say the activism in Standing Rock, where some of our indigenous people were saying no, because it's going to affect our water. Like having that pipeline run through our sacred land and polluting our water. One is this is really just an assault to Mother Nature, but also it's going to kill our people. And how, and I think those are powerful message that we as a country sometimes choose wealth and gaining wealth more than people's lives, than rather telling the truth or saying, you know, this is, your life is more important than money and oil maybe. And that's where John Powell talks about the othering, that I don't see you as the same as me, so that's why your life is less important than mine. And then Rupa Maya talks about capitalism, really, you know, that really we're so focused on wealth, that because I'm so interested in just this pipeline will really help make travel of oil much more easier at the risk of polluting somebody's or community's land. So those are just the questions that I'm really hoping you to think about as we're sort of going to this presentation. And then, you know, this discussion of like who really belongs to this country. And, you know, I don't think I need to say more about the discussion that really needs about immigration. And really our stand and why we really need to look at humanity just sort of in general. But these conversations about immigration is not new. And I just added this quickly. I thought it's funny, but really not. And my hope is that as you look at this slide and you say, I don't quite get it, that you do some research and say like, why is this not funny? And as you know, in the history of the United States, you know, that there are parts of this country that was owned and belonged to Mexico, and to the Treaty of Hidalgo for $55 million. Mexico ceded what we now know as California, Nevada, Utah, and Arizona to what we now call as the United States. So this picture really is true that historically, people in these states actually are part of Mexico. And the Treaty of Hidalgo that quote unquote ended the Mexican-American War, and that really talks about, again, who we think is more inferior and superior and who deserves the right to be here in this country. And then, because and again, going back further, or maybe at the same time actually, because this is, I think, 1882, that we in this country have sort of this history of excluding people. This is a flyer when the Chinese Exclusion Act was started. The Chinese Exclusion Act was preventing Chinese to come to this country. Again, when John Powell talks about othering people, they were okay to come as laborers, but it's, you know, when they were asking to become citizens, people were saying, nope, you're just laborers. If you could even come here, but you don't have any rights. And it's the same message that we heard when slaves were brought here in this country. So we have a really hard, bad, painful history that we are undoing right now, that I think is really asking us to do some soul searching. So putting all of that, right, all of that history, I want to say to you, because it's a part of the structural racism, if we look at data, and this came from the Racial Equity Institute, we could maybe say behavioral health could be, but if you look at the data that has sort of been coming out, that the inequities are very, very rampant. In areas such as health, education, criminal justice, child welfare, and economic, that orange line, this graph tells you what is the likelihood of bad outcomes for whites, that's that orange line, and that yellow line is for blacks. The axis on the left tells you what is the chances or the likelihood that whites and blacks will have poor outcomes in different segments. And if you look at that orange line, in the areas of death from diabetes, from the left, all the way to children in foster care, unemployment, rates of incarceration, whites are pretty much at a low point. But our African-American population have higher rates of having poor outcomes in all of them. And if you're saying, if this doesn't get you thinking, wow, in all of them, I get it, there's maybe one or two, but all of them? Well, what could be the reason? And that's where I come back again to the structures that we've created to continue to perpetuate these inequities. And I think it was Supervisor Stump that had said in that meeting to really talk about economic justice. And so I kind of added this thing from some research from the Pew Center that came, this is more 2013 data, but talking about the wealth gap in this country, that white people in this country tend to earn 13 times higher than blacks. 13 times higher than blacks in this country. And I don't even have data about indigenous people, right? And again, how we have in this country have elevated, right, wealth, and how important having wealth is in terms of determining your outcome, your health outcomes, where you live, how long you live, where, so again, if this is not something that's kind of shaking your core, I don't know what else. So I want to now come back to my own interpretation of this. And I'm going to quote a lot of what Dr. Maria talks about, specifically highlighting on structural racism, that we are actually in a society that supports supremacy. And supremacy can be seen in a few different areas: white supremacy, male supremacy, and human supremacy. And let me explain that a little bit. According to Dr. Maria, we see white supremacy, as we all know, that one race is more superior than the other. We've seen that quite a bit. And that white supremacy in this country has justified slavery, right? Bringing in people, selling them, asking them to do cheap labor for our own gain. Telling the indigenous people that this is not your land and we're gonna resettle you or actually steal your land. And actually it justified the near genocide of populations or tribes of Native Americans, right? So, I mean, there are many history of like the battle, but between sort of our settlers, between our indigenous people. And that really talks about the ideology that the standard of how we see this is that white are considered superior than the rest of the population. And then the other piece is about male supremacy, and I'm not going to necessarily focus on that, but it's really, Dr. Maria talks about, femicide and domestic abuse, right? In our society, that we still see that men have a higher standard, or we see them more inferior. And one example is that for every man's dollar that we make, women still get about a portion, 72 cents of a man's dollar. Again, it tells you that, again, an unequalness to that. But then the last one, which is really about human supremacy, that we as humans are more superior than nature. And this whole concept of ecocide, that we are killing our ecosystems, that we don't care what we're doing to the land for the benefit of wealth and capitalism. And historically, our indigenous people knew how to take care of the land. They did controlled burning because they knew if they did that, it would maybe prevent from these really massive fires. That they only used the land or use resources when they need it, right? Or the amount that they would use were only for the use for that day or that week. And they never needed to do more because they were hoarding it. And yet we are in this time thinking about things differently. The more we have, the better it is. And so when we think about climate change, right, or how we, I think, are shifting how we see our relationship to nature. And that's what John Powell is saying, that we've really lost our deep connection to nature, that nature is a part of us, and that we don't care, that many of us, maybe not me, many are still believing that climate change is not happening, and that the glaciers are melting, that we are having, temperatures are rising, that the sea level is increasing. And so I'm now putting it all together to one statement. How does this all affect us, right? So you're probably saying, well, I'm an ally, or I'm somebody that's not living in those communities that, are, that we refer to that are really poor health outcomes. I maybe, my income is higher or whatever, but eventually all of these things really affect us. In fact, more individuals of color, more than others, but it'll definitely all affect us. So this talks about the concept in medicine, what we call allostatic load, which is the total stress that people can take. And what you're wanting to do is mitigate the allostatic load, right? Meaning you can't have a lot all the time. You have to sort of mitigate that by taking care of yourself. But here in this graph, which was really this visual created by Dr. Aiton, who is part of the California Endowment, said many communities of color are having to deal with multiple stress. I think some of it may be related to some of your resident, right? Not having a lot of transportation, thinking about long commutes. If you're needing to go to a doctor, you're needing to ride 4 buses, or it takes an hour to get there. Your emergency might have gone away, or your emergency might have become more acute. Housing, I think, is an issue that you've raised, affordable housing. And I know that you said your visitors and your population increases during the summer months because of the tourists, and that drives prices and homes. Lack of social capital, when people are far apart and they don't see themselves as connected to other people, people remain isolated, they are distrustful. Racism, thinking I've hopefully made that point today. Racism eats at our core when every day, every minute you get experience of being considered as other. High demand, low control jobs. So we know that communities of color tend to have low paying jobs or jobs that have really low control. Lack of access to stores and jobs and services create stress. And then crime. All of this really affects individuals and specifically affects communities of color at a much higher rate. And so when we're talking about equity, we really need to think about what can we do to change the story so that people don't get affected, because it literally is in people's genes. And so how do we know it's in people's genes? Well, we have this concept, we have a little tiny gene, or we have our tiny chromosomes in our body, and there's this little cap, you can see that little cap at the end of our chromosomes called telomeres. And telomeres actually tell us how much we've aged, right? How much we've aged. So the notion is the more mature you become, the shorter the caps are, it shrivels to a much smaller, less pink, less red. But we're seeing though that the allostatic load, the stress, the trauma, actually shortens the telomeres much quicker in communities of color that experience stress, generational trauma, poor health outcomes, pollutions. And this though is important because the telomeres are passed on genetically. So that you might have trauma that had happened to you centuries ago that continue to affect your body generations after. And if you are to truly change the the outcomes of people, you need to really change the structures so that people's literally telomeres don't change, because it's in people's body, literally. People are dying because of all of these things that we have done. So my thesis is is really racism kills, whether it's through force or depriving resources, discrimination, that it's really a fundamental issue that has created disproportionality and even death and health inequality. That unless we are going to tackle this head on, both heart and mind, we are going to sort of go around in circles. I did a little research, and I'm hoping that you will indulge me a little bit, because again, I'm just a guest. And I'm showing some of this data from your community health needs assessment, some of your census data. About 14,000 residents. Your population is 65% white, 28% Hispanic. Again, thinking about the disparities there, right? That there is actually some of the history that you can maybe not undo, but change moving forward the experiences of these individuals and these communities in Mono County. It's sort of interesting to me, though, that you have a much younger population. And so I'm thinking that, and I think it was Sheriff Braun, maybe in her remarks, or maybe Chair Corliss, that the protests that were sort of happening were led by young people or younger people. And that really is seeing that some of the status quo that we've done has not made a difference. And so it's really time to think and have bolder moves and bolder actions to change. And as I'm looking at your data a little bit, again, most of your residents are white, but your poverty level is skewed towards the Latino population. And so thinking about, again, the disparity there that exists, because even if you are significantly white and only about 1 out of 4 are Latinos, you have a sort of a higher rate of poverty in your community with Latinos. And then again, I'm not saying that I have read thoroughly your report, but one of the things that stood out to me as I was reading your 2019 Community Health Needs Assessment that are basic, in my opinion, to address as you're thinking about this differently, is providing the ability for folks to be able to speak in the language that they're comfortable, especially as they're trying to get help for health, the ability to have timely access. And I know that there's all these transportation discussion. I think thinking about maybe creating, as appropriate, more closer to the community so that they don't have to wait and they have to struggle finding a bus to go somewhere when they're needing assistance. But also addressing sort of your affordable housing, which is really for many communities provide some sense of security for many of us, right? And that thinking about like what are some policies and opportunities to help create more affordable housing in your county. So I want to end by saying I don't want to leave with making you say like, oh my gosh, what am I going to do? But I want to end with a framework that Director Robin Roberts is aware of. And a suggestion that as you are moving forward this work is there is a model by a national network of local governments that are coming together called GARE, the Government Alliance on Race and Equity, that have come up with a model on how to start kind of this work. And the model is you normalize the conversations, you organize together, bringing in partners, tribal folks, community members, residents, sheriff, whoever else. And then you operationalize, what does it look like when you are seeing equity in Mono County? How do you see that when you've reached it, right? So this is, I'm again not going to spend some time, and I'm happy to come back and share this, but, and they're available in the way I put their website. And normalizing, you have as a community come together and feel like you can have these conversations, even if they're painful. Having foundational knowledge of these concepts that I talked about. You using data, right? But more importantly, storytelling, because at the end of that, at the back end of that data is people's stories. You know, and I often see in meetings where it's all about data, and I realize, hey, these are people that we're talking about. So unless that data is justified or aligned with people's stories and real people, it's just a task. Organizing, you really need to come together. This work cannot be done by any one person or one entity. So you need to engage. You need to engage people. You need to engage your residents. Right? And then again, building the structures. I heard that you have now created an equity committee. I think that's important because you can't have one person do it, but make them feel empowered and give them the resources to kind of do this work. And then again, operationalize. What will this look like for Mono County? 5 years down the road, 2 years down the road. And I think that's the conversation. So I'm hoping as you dig in a little bit more deeper with your work is that you can use this tool as a starting point. So I do this work because I'm hopeful. I'm a psychologist because I believe that and hope and that relationships with people really help us change. I want to sort of kind of end by saying, I think we really need transformation. I think Chair Corliss, you said that you need transformation as you told your story last in that meeting in June. Dr. Butler talks about her definition of transformation is that it's really a collective, that we as a collective group need to address power, economics, and our cultural ways of being, how we are together, how we see ourselves, how we communicate, how we deal with each other. And that we need to drive the creation of new systems that highlight, number one, community safety, economic security, and really the kind of healing that we need as full people into whole, right? If we look at the generations of trauma that many of us have experienced, people are broken. If you look at what's happening now in this country, people are saying, don't kill us. People are broken and are in desperate need of being healed. And so radical transformation or transformation talks about community safety, economic security, and seeing people as whole people. And so that when we provide the care for them, we see them as a whole. So I want to end as really a call to action to you. And one of my favorite scholar activists is Cornel West. I really feel like the work is really about love. You know, love for humanity, love for all people, love for helping other people. And he says, tenderness is what love looks like in private when we're in relationship to other people, whether it's family or friend, and how we're tender with them and kind to them. But justice actually is what loves look like in public. And so my call to action to you is, what are the justice-filled things that you're going to do to show your love for your residents? Thank you.
Thank you very much. There, we can see each other again. Thank you so much for that presentation. I know we all have a lot to think about, but I'm hoping we can have a discussion today. And I know we have a number of employees, not on the panel, but on as attendees, and we want to hear from you too. You know, what this looks like. What do we want to do as Mono County? Do we want to look at using this GARE framework as a way to continue our work? I don't think we have necessarily formally established an equity committee. And I want to name something as a board member that I hope my board colleagues will join me in recognizing that we mustn't place the burden of this work on our staff. And say, well, Robin's really good at this stuff. Let's have behavioral health do this for us. I think we'll hear from our departments and I hope have a willingness to work on this, but I think we as a board need to take this on and ask our county administrator, who unfortunately is ill today and couldn't be here, you know, to take this on and to create capacity for it. If our first thought is, oh, we don't really have the ability to do this right now, we're too busy, then I would encourage us to find a way to do that and get the resources. So what I'm hoping I don't think we're gonna have all the answers today, but I'm hoping we can identify some next steps, maybe commit to using this framework that has been presented, forming a committee or some other kind of structure to make sure that we have accountability and a group working on this. And then also another thing we considered was doing as a board some kind of resolution to memorialize our commitment to this work, recognizing other counties have passed resolutions to recognize structural racism as a public health crisis, and to maybe name some things that we could commit to as a board and a county to address. I would turn it back over to my colleagues who've been working on this, to Cassandra, Jasmine, Ingrid, Sheriff Braun, and Robin, and then open it up to the board, to other staff and the public for discussion. Go ahead, Director Roberts.
I would like to start, Jay, Dr. Africa, by saying how moved I am by your presentation and how moved I am by you in general. I know I'm lucky I get to work with you in lots of different areas with the work that we do for the behavioral health community. But the courage it takes to do this work with people that you don't know at all, and to do it so well, I just so appreciate you. I think also to our Board of Supervisors and all the people on the panel here, I feel honored to work for Mono County. I look forward to whatever is next in the Behavioral Health Department. While not wanting to be right in the lead of it, will help in any ways that we certainly can. So thank you.
I'll throw in, thank you, Dr. Africa. That's a lot to unpack, a lot to process for a lot of us. I just said a lot 3 times, but it's a process for us to look at it and look at ourselves and say, does that apply to me? And yes, it applies to all of us, but it's hard to do that and hard to accept that. So I'd like to hear from other department heads and from other people on the panel what they processed from that and what they heard, and did they see themselves or they see their community in that, especially for us as it applies to our tribal communities. How do we interact with them and how do we work with them? So thank you for that. It was, like Robin said, moving.
And if I may step in, I'm Stacy Simon, the County Counsel for Mono County, but stepping in here just in this brief window where I'm acting CAO, because as mentioned, our County Administrative Officer is out temporarily. And I think it's more in that role just to say that it is appropriate for staff from multiple disciplines and departments across the county to be involved in something like this. And that's certainly, if that is going to be the direction from the board, makes a lot of sense. And we would hope to get participation from a broad variety of perspectives and from departments that all have a role in impacting how our community functions. I noted in your presentation, Dr. Africa, that you had reviewed the Public Health Community Needs Assessment, which was the culmination of many years of work and much, much outreach by our Public Health Department. And I think that document has a lot of valuable information in it, and would be a great starting place to look at where gaps are, where work is needed. And again, I know we have a lot of enthusiastic employees who are would love to be part of an effort to improve their community.
Yeah, hello everyone. So definitely thank you so much, Jei Africa, for this presentation. Through my department, I've been following a lot of your frameworks throughout, the county, through the CBHIS and stuff like that, as well as, just echoing what Robin has mentioned, through the Cultural Outreach Committee, through our Behavioral Health Department, we are working with tribal members, with Itoyabi, and me working with the Latino community outreach, we're looking to address this and, for everyone as well. And I am looking forward to be working with you as my mentors so we can, work on a framework that we can present to not only just for my department through behavioral health, but for other departments as well as in our county.
Oh, sorry, Jasmine, you go.
Hi, this is Jasmine from probation. I just want to thank you, Dr. Africa, but also I wanted to thank all the participants that listened in today, taking in all this information, knowing that it's a very hard subject, and being open to change. So thank you.
Thank you, Jasmine. And I just want to thank the probation department. Originally, in my experience on the board, has invited other departments and county colleagues to join in trainings to start thinking about disparity and implicit bias. So I appreciate the probation department helping us start that work. And, go ahead, Robin.
I can't tell on my screen if people know who are in the audience, because there's quite a number of people listening in. If they know to just raise their hand and then they can participate, is that how it works?
That is, yeah. And so if you've never been, the way using the Zoom webinar, we panelists can see the number of attendees. And in some cases, if you have your name on there, we can see you're on there. So we welcome and encourage discussion. And yeah, and we have a hand raised right there and would love to hear from you.
Yvonne, you should be able to unmute yourself.
Hi, everybody. This is Yvonne, and I work for the Department of Social Services. So one of the, you were asking for what would be the next steps. Working for social services and given the presentation, one of the big things that I've seen in our community is a lack of health resources. So just a clear example is just an optometrist or a dental provider. I had an individual call me yesterday saying that 2 months ago, she wasn't able to go into Mammoth Hospital because there just wasn't any staffing. So my thought process was, well, can the county go ahead and somehow subsidize small businesses or to have somebody here in this area? Thank you.
Great. Thank you, Yvonne. And thanks for all your work, through as part of the COVID response team, really helping individuals in this county navigate the system. And, it's incredible. So thank you for your input, and I'm glad you spoke up today. All right, I'll continue to encourage anyone to raise their hands, but I will also, oh good, we have somebody.
Brianna, you should be able to unmute yourself.
Hi, this is Brianna Cuellar. I work with the Mammoth Lakes Chamber of Commerce, and thank you so much, Dr. Africa, for your presentation. I found it very insightful and helpful. Something that we are working on at the Chamber is trying to work to be more inclusive in putting out more publications that are available to our Spanish-speaking community. And just something we've been struggling, and Cassandra, seeing you on here, I'd love to talk to you more about this, is just we very much want to meet the community where they're at. I think that some of the ways that maybe we are choosing to communicate don't necessarily translate or work in different communities. So I think that's something as the Chamber of Commerce, we want to be more inclusive to our Spanish speaking employees and community. And I think we just need to work on what exactly that looks like, because it might not look the way that we want it to look. So just throwing that out there. Thank you.
Thank you, Brianna.
One more technical question. Someone asked me, there are some people that are on the phone. So if they want to speak and can't raise their hand, do they push *6?
It's *9.
*9. Thank you, Queenie.
Sure. And Nate, you should be able to unmute yourself.
Thanks. Yeah, very much appreciate the presentation and all the comments. I guess I have two questions. One, do you have any advice or guidance to us as an organization for ways to improve or increase diversity among our teams, be that through recruitment or how we outreach those recruitments, or whatever sort of stems away from that? And then two is, once we have diversity on the teams, how do we honor and respect it and make sure that it is being utilized effectively?
Not sure if your process, did you want me to respond to that or did you want me to wait? I don't know what your
Oh,
process.
go ahead, Doctor. Go ahead, please.
I certainly don't mean to be the expert, Nate, but many counties are struggling with that, to be honest with you, about really diversifying our workforce. I think working with county HR is really, I think, a first step. I would also think about, in behavioral health, we do a lot of growing our own, right? So really thinking about a pipeline, starting with schools and saying, like, how will people get interested to be part of our, kind of our workforce? So we're partnering a lot of that. I think, and then as you bring in folks in, I would work with HR to think about succession planning, mentoring opportunities for your staff, because, moving up the ladder is challenging, like not only as if you're a diverse person, but the mere fact of taking more responsibility. And so having, I think, intentional mentoring and coaching opportunities helps you, how do you show up as a leader? So I think that would be a suggestion. In some counties, they're looking at really like looking at how do they recruit, like how do you really get people, what's important to folks, to and to sort of moving into the communities as sort of and staying there. In Marin, actually, we have a very high commuter population as well, so we're struggling with the same issue and really thinking about ways to incentivize folks to here, but also looking at our pipeline. So we have an internship program, for example, that gets people in the door and hoping to sort of move people through the professional ladder. So those would be suggestions. I am a believer of really succession planning and helping our emerging leaders to sort of keep moving up and mentoring opportunities. So those are the things for me I would think about. And working with maybe schools to think about how do you get people invested to say, I want to be a therapist, I want to be a county employee. Because there is also that notion about working in local government, or government is not necessarily bureaucratic, too much red tape, right? And really changing that and say, you can really make some differences being in local government. And, here are opportunities to be part of a system that can change people's lives. So.
Thank you. Yeah, looks like we have Sophia.
Sophia, you should be able to unmute yourself.
Hi, can everyone hear me? Sorry, I've been having
Go
trouble with
ahead.
my audio lately. Yeah, I just want to further the discussion on what Nate just brought in about being able to diversify teams, bringing in the outreach. And I think also something to think about, and maybe you can speak about what other counties have done or any advice, Dr. Africa, is that what I see a lot in teams and what I hear from my colleagues is that sometimes even when teams are have a lot of different diversity and different voices, sometimes it's hard for us as kind of like the line work, not in leadership, how to be able to speak up. So more talking to leadership on how can leadership make that space safe for us line workers to speak up, because honestly, sometimes it doesn't feel safe.
And I will tell you that I believe Sophia is that is an issue that all organizations struggle with. So Mono County is not unique in that. All organizations struggle with, especially in conversations that really, now, and I'm not just talking about this racial justice, of really being able to say, oh, I disagree with you. That's not how I see the world. And I feel like, the GARE model we need to really spend time normalizing, right? We need to create a culture that can embrace this, maybe not, this is not the word, conflict, right? That healthy conflict that we can say, oh, what, that's not my experience. I disagree with you. But unfortunately, that's hard, especially if you're a person of color, and then your boss is white and your leadership is white. So there's a trust issue there. But I feel like if you, as part of doing this work, you can, normalize and create some practices that will help grow trust over time, because trust is earned. But and it takes a while for you, like if I don't know where you work, but if you work in direct service, right? Clients take a while for us to trust us, but we have to think about ways to kind of do it that way. So I think it's building a culture that you trust and creating a culture that you're open to feedback. And then, but your leadership saying, you know what, I own my privilege, I own my power. If you're a supervisor, if you're a director, if you have a position, and what can you do? Remember, going back to that internal level, what can you do to do some soul searching so that you can show that you are really wanting people to engage in a healthy conversation, that people can disagree, that when people disagree, they're not going to be penalized, for example. So I feel like you need to work that in your programs or organization. And trust looks differently for different places. And again, I'm an outsider, but I feel like you can build on that and saying, as an organization, if we are going to have these really hard conversations, what are the parameters? How do we build that? How do we build that in our teams? How do we build that in our communities? And there's a lot of work about building trust, psychological safety, right? That really enhances relationships. So that might be a good starting point.
Call in number ending in 1273. You should be able to unmute yourself.
And remember, press *9 to unmute on the phone. Oh, maybe there may be an issue. We might need to come back to that caller. Or maybe, so Queenie, what is there a different thing they have to press to unmute themselves? I have all the different platforms confused in my head now.
I believe they should just be able to unmute themselves like a normal phone call. It's not *9. They'll just raise their hand again.
There we go.
Hello?
Hi, we can hear you now.
Hi. Okay. Hello, everyone. This is Charlotte Lang. I'm the Mono Lake Kuzutika Tribal Chairperson, and I'd like to thank the Board of Supervisors, Stacy and Dr. Africa, for having this conversation. It's a long time needed. Dr. Africa was quoting there wasn't how many Native Americans that live in this Mono County because we're landless. But there are a few of us still here, indigenous, and hopefully that'll change soon because our bill for recognition is currently moving to Congress. So a lot of us will be able to come home and say, excuse me, I've been having a sore throat here. But on certain issues of like probation department, I was a preschool teacher for many years and worked for behavioral health and got into the community because of our Native American people. We needed a voice in the community. And I went to work for the probation department after right before I retired, and I was questioning why so many Native American kids were in there. And so I wanted to go in and see if I can maybe change some behaviors. But I asked the judge one time, I said, what is the criteria? Is it only the Native American kids or people of color are the only ones in trouble? Because I live in a community where I see a lot of non-colorful people that don't get arrested, and our people get arrested for the same thing. So I've had these discussions, and the same behaviors happen through the police and arrestment. And some people feel that it's really important to get them off the streets, I guess, or whatever kind of became the end of the conversation. But while in there, we got quite a few of them graduated. So I felt in the way of weighing, of being arrested, blah, blah, whatever, no matter what color you came into the program, at least you got your diploma when you left. But those are kind of some of the problems I see. But I really love having this conversation, and hopefully I can be on a committee to change, quote unquote, as you were saying, we're having this hard conversation of entitlement. And that's part of the biggest problem, you know, that you get to live in this great big mansion that you're destroying Mother Earth, whereas the little Indian people lived in little tiny houses that saved the meadows, saved the bugs. We spoke for the deer. So anyway, and I'm not throwing down, but this conversation is good. And like I say again, thank you, Dr. Africa, for bringing this to this valley. And on just one big issue is being involved in the community. I became involved with the Keep Long Valley Green as a spokesperson, as a tribal, and as everybody else is concerned, was for the ranchers to keep the water flowing. And quite a few of us became diverse groups, Sierra Club, blah, blah. And in talking for the sage-grouse. So there is conversations and people pulling together because we all do think on the same terms as keeping our country green. And it was nice to be able to have that conversation with all of us at the table and made some changes, small changes. We want more changes in our country up here, but definitely our Native American people are going to start having a voice a lot more and help resolve some of these issues to keep our Mono County beautiful, diverse. But as you were talking about, what do you do? Well, your first thing is to get into that school system, because where do these kids learn this behavior? These little guys come to Head Start. They don't know what color. All they know is, that's my friend. But down the road somewhere, somebody that's an adult is teaching this poor child to become a racist. And racism needs to be abolished. So in speaking that, and get in the school system, and let's start bringing these kids back together so they can take it home and teach their parents or whomever's doing this bigot behaviors that we're all good people. We all go to the bathroom, we all bleed, we all have to comb our hair. When we hurt, we scab up. So thank you again, Dr. Africa and Board of Supervisors and everybody for having this conversation. And again, I would like to be part of this committee. Thank you very much.
Thank you very much, Tribal Chair Lang, and congratulations. I'm so happy that the legislation for recognition is finally moving through Congress. We welcome your participation on this committee and in this work.
Michael, you should be able to unmute yourself.
All right. Thank you, everyone. Thank you, Dr. Africa, for spending the time to develop this presentation. That really was beautiful, and really, really appreciate it. First off, we are definitely a community here that shares a lot of information on the internet and through social media pages and things like that. So I really hope this presentation at some point makes it to our social media platforms and it inspires a lot of our community. I also wanted to touch on, there was a point during your presentation where you had actually kind of assessed the whole idea of pointing fingers at, certain people and how we can really dismiss that. You made mention of John Powell and Cornell West. I was wondering, through your academic research and all your work with the state of California and moving, to the Western world and stuff like that, are there any other academic figures or people that have really inspired you along the way that you would recommend people kind of dedicate some more research and time to?
Like, can I just, this is the time to actually, I can't, gosh, many, the work that, Ibram Kendi's doing, all these books that are coming up, Howard Zinn, who talks about the history of the United States and that really understands the communities of color. So there's actually now a lot of things that are coming out. Black Lives Matter, for example, talks about their work. So I feel like this is the time to just sort of be open to thinking about, like, I actually have been reading about the history of policing. There's a book that just came out that talks about, so there's a lot, and I'm happy to, maybe give you or send it to chairs, whoever, give you some of that. There's just so many out there. Even if you just Google, like, I want to know what racial justice, but John Powell to me, and Dr. Mario Rupa have been, I think for me, are easy. I can grab it in my, the concept are kind of easier for me. It's belonging and not. So that's why I really appreciate their work. But there are many other scholars, Angela Davis. There are many people. Policy Link is an organization that does some work there. In the Bay Area, it's Bar High. GARE, if you go to the GARE website, there's actually a lot of work there. We'll have to work there as well.
Excellent. Yeah, I just wanted to compliment you one more time. We're dealing with so much political finger pointing and within our communities and stuff like that. And it's such a breath of fresh air to see somebody kind of, taking their own actions, being accounted for their own actions and just, trying to bring people together and really set the example that we all need to work together in order to move forward. We need to understand each other a little bit more. And it was just such a breath of fresh air. Thanks again for that. And any other insight or any resources you could share, I would definitely be happy to pass along to the community and my coworkers, things of that sort. And once again, thanks so much for being here and taking the time today.
All right, we'll still keep the floor open. But I also want to give my colleagues here a chance to weigh in. And again, I hope we can leave here with some, with some next steps and ideas of where we take this. So could I start? I'll start with Supervisor Gardner.
Thank you. I would certainly add my thanks and appreciation to Dr. Africa for an outstanding presentation. We know from certainly Robin and certainly you, Dr. Africa, that the first step for good mental health is acknowledging the problem. And indeed, whether that is an individual acknowledgement or it is an institutional acknowledgement, your presentation today helps us, at least helps me, do that 1,000%. And I thank you for that. Now then, and I think this is what your intent was, so what are we going to do about it? Lots of things have been said about lots of problems over time, but what has really made the difference in improving the quality of life for everyone is what someone does about it. And I guess that's where I go. The question is maybe too general. Who's doing this the best? And you've touched a little bit on those who are thinking about it from a research standpoint, but who, as a perhaps government or nonprofit or foundation, who's doing this the best in terms of information that we can use to say that's what we should do, rather than think about things. And we can certainly come up with our own ideas, but I'm a big fan of stealing from others who are successful. So that's one question, is who's doing this the best? And then another thing is really your emphasis on addressing the priority of wealth in our society. That drives decision-making, that just drives policy-making. We deal with that every day in every meeting, and we either confront that or we dance around it. But I think you put it on the table, and I would offer to my colleagues, we either address that issue in terms of our policy and decision-making, or we don't and will not make progress on this issue, because that, as I heard from you, goes directly to the issue of inequality. And I think we have to constantly struggle with that and have actionable items that address that in terms of priorities in our thinking, priorities in the use of our time, and priorities in the use of our spending. And then the last thing is I would say we should form a committee today to deal with this, not tomorrow, not down the road, and talk about, at least generally, what will they do? How often will they meet? How will we see their accomplishments? And what will be the evidence of progress on this? What gets measured gets done. And if we don't make this tangible starting today, then it's all been great and we've learned something, but we've not moved forward.
Great, thank you. Supervisor Stump?
Thank you. Thank you, Dr. Africa, for making the time. I wish we could have done this in person. I like seeing the whole being rather than just the Zoom square. I think that statements are fine, but statements have been made for years. Modeling behavior contains more power. You know, I'm the oldest person sitting here, even older than Supervisor Gardner and Robin. You know, I remember my first exposure to this kind of a program was a high school assembly, 1964, after one of the Selma marches. Did it again in 68. Did it again during the 70s when I was attending the University of California. Did it again because I worked for the state after the Rodney King acquittal of those individuals. And what needs to happen is 20 years from now, someone like Dr. Africa doesn't need to be readdressing this with a group like us. And to change that, I think behavioral modeling is part of it, because behavioral modeling requires behavioral responsibility on the part of everybody. And behavioral responsibility can embody things like compassion and equanimity, which tend to blow apart the whole separation issue that you identified so well in your presentation. As you said many times about genetics, I have a daughter-in-law who's a geneticist and who's reminded me repeatedly of how much we're all brothers and sisters. 95% of our genetic material is identical. Everybody across the planet. And to your point of genetic telomeres damage, although it's not a population of color, they documented Holocaust victims and what has happened to them and their genetic structure. And it is ongoing and it does continue. So I think as part of this, we need to model behaviors ourselves. We need to, on an external sense, the policies of this county need to be oriented to model those behaviors. We need to encourage, as was talked about by Sophia, an integration of staff at all levels. That's modeling those behaviors. And modeling behaviors that aren't judgmental and aren't telling, I think are extremely powerful. And I'm revealing some of I have a new sister that I only discovered 4 years ago through Ancestry.com. She is a Buddhist. And many of her concepts really ring with me. And so rather than just limiting to statements, rather than just forming a committee, unless the committee is willing to model the behavior they want to see, I think we need to focus on how we treat each other, how we respect each other, and we need to be visible in that as an entity and as individuals. I'm not going to be here long, so I really don't know how much you want me to weigh into what the county should do in 2021 or 2022, but those are my thoughts. And your being here, Dr. Africa, really stimulates all of this discussion. And I hope you don't mind me waxing a little philosophical there.
Thank you, Supervisor Stump. I'm just going to go ahead and say that we want you to weigh in and participate. You're here, and we're glad you're here. And Supervisor Peters.
Thank you. And thank you very much for the presentation. My brother actually lives up in Marin and in Tiburon, and we all grew up in San Fernando Valley. And I moved to Bridgeport over 20 years ago, about 22 years ago. So I feel like I've seen a generation of kids grow up, including mine. And I want to talk about, I think, what could work or what we need to work on here, which is I'm in the north part of the county. We don't have medical services within 60 miles. We don't have hospitals. We have a clinic a little bit in the north part of the county. But what I want to hopefully work and continue to work with Robin on, and I think COVID's really gotten in the way of the connectivity with the community and the kids. And you touched on it, and it was going through my mind. We got to get to the kids early, and we got to figure out a way for the families. I've seen what's happened, and in the same family, in the same household, one child will move forward. They go out of the community to get educated. Some come back really quick, and there's no mechanism to give them that second chance, that boost to, get that comfort level to come back out and break the cycle of sort of the families that are the backbone of our communities. We need to represent that. We need to represent as a community, as a county, and I think the sheriff has been working on this, to have our workforce look like our communities. And I know one of the families here has 2 kids. One's in law school, early 20s, one's in the highway patrol. And the family right next door is not as fortunate. So we got to figure out a way to give a second chance, get another connectivity to these kids. And these are kids in their 20s. And what we lack in our unincorporated north part of the county is any youth programs for the teens, for the early teens. So when they're done with school, they might be in a sports program, but if they're not, there's kind of a gap. And so the mentorship with the county, hey, being involved with local government, those type of things that you said, I think those are things that can work up here, but we have to have a way to get to these kids early and to the families and get them involved in the community, whether it's through the chambers. I think the Wednesday night socials that behavioral health does and was doing was awesome. And that's what we need more of in the communities up here. And to be able to touch that youth. I know that there used to be, just even through church camp or things that they don't exist anymore up here for whatever reason. They were here 10 years ago, 15 years ago. So how do we get the kids together? And sometimes the only exposure that they have outside of our county during their formative years, it might be a trip with the high school to go to visit colleges. but we need to figure out a way to get exposure to the outside of Mono County at an early age in some way, not going to Disneyland, but to really see culture outside of our communities and bring it back. So those are some of my thoughts, and I hope I will participate in whatever way and whatever resources that we can provide as policymakers and, you know, budget overseers. Then we need to do that, and we need to work together with all the departments in a strategic sort of effort to make a difference, and not, as Supervisor Stump said, be having the same conversation in 20 more years.
Great, thank you, Supervisor Peters. And I have some ideas that I'll run by my colleagues, but I see we have somebody else wanting to speak, so please go ahead.
Taja, you should be able to unmute yourself.
Thank you, Queenie. Hi,
Hi,
guys.
Taja.
Taja from Mono County Behavioral Health, as well as First 5 California. Dr. Jei, I am going to try to do this without stuttering. I am totally starstruck by you. You're like one of my biggest heroes. Huge fan. So going off of what I've heard from Supervisor Peters, as well as Gardner and Stump, what strategies do we use to begin to increase the interest of the members of our community about the interplay between structural racism, institutional racism, implicit bias, etc.? Like, what path do we take to eliminating or strategizing the racial disparities? Like, what's the blueprint, or are we making it now? Is that what we're doing now? And how do we get it into the schools? I really truly believe that starting with the kids, like planting seeds with the kids, changes the futures, and it's imperative that we do that. So how? What do we do?
Great, thank you. So in wrapping up today, thank you, Taja. That actually is, what do we do now? Before we dig in, I think one thing we tend to do on the board and in government is just sort of plow straight in with linear thinking, and we got to go do something right away. I'm just going to, give us let's just take like 10 seconds here in silence and just breathe. What resonates? How do you feel? Just think about it for a second. Thank you. And again, thank you, Dr. Africa, for this presentation. I feel incredible gratitude to work at an organization and in community that cares and is clearly very willing to engage in this. And, whatever we come up with today doesn't have to be perfect, but I heard many, I always know I can count on Supervisor Gardner to ask us to measure stuff. And he's right, we want to have outcomes. I heard a lot, I've written down 10 different things that are within the purview of county government that we could work on, ranging from just recognition and making a commitment to equity, to education for ourselves and our community, even putting together, I think Michael said this, some kind of a reading list or providing resources for ourselves to educate, providing more equitable healthcare resources throughout the community, improving transportation, translation, outreach to communities, meeting people where they are. All of these are things that we do and that we could, and these are just ideas that I heard today, repeating what I heard from you. And my suggestion is that we do have a group dedicated to doing this with representation from the Board of Supervisors, and I'll look to, county. I think we will need to bring this back. We're running out of our time today. I would like us to go ahead and, in our governmenty county way, passing a resolution says something. When we didn't want the county to burn down, we passed a resolution banning campfires. So I would like us to do this, and my wonderful people in behavioral health have already started this, but I will commit to using some of the things we talked about today to bringing back a resolution that could do a few things. It could commit us to this work and to forming a committee, and I would love it if the committee included, we heard from Charlotte Lang, our Kuzetica tribal chair, invite other tribal representatives, could include representatives from schools, county staff, and community members. The GARE model, this could be something that we commit to using to provide a framework for our work. That doesn't mean we have to use it forever, but at least even just to start us out, and again, this is just suggestions, but coming up with something to move us forward. And so it would really be, doing this resolution to get the committee working and, maybe capturing some of the ideas that we heard today from our staff, to get us started. Does that sound agreeable? And would anybody like to, as chair and as somebody just personally really committed to this, and in the absence of our CAO facing some health issues, I don't want to overcommit him. So I'm happy to work on it. How does it work? We have another board member do it. Are we forming a committee already?
Well, yes, I was going to jump in on the Brown Act. If the board establishes some kind of committee, then that is a Brown Act committee, which may be a good thing or a bad thing, depending on what you're looking for. The only exception to that would be if you had a very small committee made up of no more than 2 board members, and that clearly does not meet the goals that you're describing. So I think it's—
But for now, though, like for today, could Supervisor Gardner and I say, we're going to go work on this and bring something back?
Yes, you could do that.
Okay. I think I saw he was either raising his hand to volunteer or swatting something away. Okay, yes.
Yes, the only thing I would add would be that we, from a priority standpoint, bring this back for either this meeting on October 6th or October 13th, so that we do not lose momentum.
I think October 13th is a great day. It's close to Indigenous Peoples Day, which we recognize here in Mono County, and would be a good time to talk about it.
Great.
And I don't think we're, I'll just put it out there. We're not formally establishing a committee, but obviously we would welcome feedback and participation. And to Jasmine, Cassandra, Robin, Ingrid, and Amanda, who've already been working on this, we appreciate your participation. And should you want to continue guiding us, in the right direction, we obviously would welcome your participation. And any closing thoughts? Robin, it's too late. You had your microphone on. You have to talk now.
No, I just wanted to say, yes, we were happy to participate. And I've been getting a couple emails from staff members throughout the county who are interested. So I'll make sure those get forwarded to you and also different community members.
And I know, and this came up, sorry, this will be, obviously it's part of our regular meeting. We always have the meeting videos available on Granicus. I think we should be able to, I'm not sure if we can have this presentation available as a separate YouTube video. If we can, I would love to do that. If not, it is available on our county website via Granicus. And Dr. Africa, do you have any, go ahead. County Council.
Just, Robin, I've been taking notes and compiling a list of folks who've expressed interest. So if you want to just forward anything to me.
To you? Okay.
Ideally, any committee that would be formed would be directed at the staff level so that we preserve the flexibility of the board to address it at a more policy level.
Okay.
Okay.
So I just want to say thank you so much for the invitation, and it looks like it hopefully sparked a bigger conversation. And I do want to say, if there was some agency that was doing this well, I would be there. But the thing though is all of us are struggling, I believe, but doing something different is the step, right? The goal is not perfection, but just to do something different. And as you're doing that, and as you're defining the benchmarks, I really think it's important to engage as many people as possible, because I think this issue is really a community issue. And as many people you engage here, I think that it will feel more like there's really creating some movement here. I mean, change really happens with people coming together and really saying, like, their perspective. And I think that's what, but I do wanted to say thank you for the opportunity to be here, and really your leadership. I know when I asked if how honest you wanted me to be, I think you said you have to be honest. And so I think I really wanted to tell you the truth so you can use this information to really be better. So thank you very much. And please let me know if there is anything I can do to support you. Thank you.
Great, thanks. We can probably use your help continuing on. And thank you for this wonderful presentation, important presentation. And yeah, and I think, one thing that really resonated with me is this idea, that racism comes, disconnection is a big part of that, and connection is something we can do, and a goal we can have to strengthen our communities. All right, well, thank you everyone. That concludes our Board of Supervisors meeting today. Thank you so much for being here. And we don't have a meeting next week. We will be back on October 6th. And we will, as Supervisor Gardner said, we will address this topic again on October 13th. Thank you. Take care.